episode 3 of the COVID Chronicles of Horizon Pharmacy. So I'm Heather Naylor, the Pharmacy Research and Education Coordinator, and our guest today is Jonathan Stevens, who's a pharmacist in St. John. So John, why don't you introduce yourself to the listeners and tell them a little bit about yourself?
So hi, thanks for having me, Heather. So I have a fairly long job title. I'm the interim clinical resource pharmacist in oncology, and also the stem cell transplant pharmacist here at the St. John Regional Hospital.
Awesome. So, and John was one of our pharmacy residents. What year was that now, John?
Well, we don't have to chronicleize that, but it's back in 2014, and I was actually a pharmacy student intern in Horizon 2 all the way back to 2011.
So he's been with us at different stages in his career and a great addition to our team here in St. John and doing lots of good things in oncology. So John, I know when COVID-19 hit, oncology was one of the areas that was affected, where it's an outpatient population and a lot of people immunocompromised and different things going on. So can you walk us through what types of changes had to happen in your department?
Yeah, so thanks, Heather. So I'll actually take the approach of looking at our department threefold. So I'll talk about changes in the outpatient setting, the inpatient setting, and then changes specific to our stem cell transplant team as well. So without a doubt, in the outpatient setting, the biggest change was the limitation in our clinic visit. So those patients that could be were immediately transitioned to be seen virtually or through telehealth follow-up. And with this, we also eliminated our in-person teaching sessions in the outpatient oncology clinic as well. So traditionally at our site, all patients starting oral anti-cancer therapy were taught in person, one-on-one with a pharmacist locally. But in order to limit exposure and patient traffic in and out of the clinic, those teachings were moved to phone-based teachings. We also used to do a class-style education session for our chemotherapy patients, but also our immune checkpoint inhibitor patients. Fortunately, the immune checkpoint inhibitor patient education PowerPoint was already recorded and available on YouTube. So we started sharing that link with patients, and then they could ask their treatment room nurse any questions they had specific to their therapy. Moving to inpatients, so on the inpatient side, we immediately eliminated bedside rounds. So the pharmacists working on the inpatient unit were still involved with the team, but only the patient's nurse and the attending physician would go in for bedside rounds. That was a practice for a few weeks, and then as we got a better handle on case counts locally, we eventually transitioned back to our previous model with full team rounds at the bedside. And then finally, on the stem cell transplant side of things, so we immediately postponed or delayed all non-urgent stem cell transplants. And those patients that needed to be seen urgently were either set up for Zoom-style consults, which was unique. So as opposed to seeing the patient as a transplant team, you're now seeing them virtually via webinar and doing med histories and eliciting that initial follow-up, that initial consult by virtual means. So that was definitely a transition in practice for sure.
So a lot of technology-based changes, so phone calls and Zoom. Do you see going forward keeping any of those changes? So have they helped improve things for the better?
Yeah, so I'm actually really excited about the opportunities that we'll have to kind of use specifically the virtual technologies that we've kind of been forced to adapt in the pandemic. So we're looking to kind of advance that virtual education on a continuous basis to try and better meet the needs of our patients, so it would limit those patients having to travel from away to receive that education. And also we're considering, because where the video teaching was so effective for our immune checkpoint inhibitor patients, I'd like to move towards recording some video teaching sessions for our more common oral anti-cancer therapies, and then hopefully sharing those with patients by virtual means, and then allowing for follow-up with one of our pharmacists afterwards to clarify any questions or concerns. And then I think also as patients are kind of forced to become more used to these virtual care resources, there would be an opportunity to expand our clinic roles as well as pharmacists. So right now clinic time is very essential. It's necessarily been cut back, but if we could better interact with our patients by virtual means and still get an adequate assessment done, and there'd be some opportunities for expansion there as well.
That's great, John. Great initiatives. Be excited to see what comes out of that going forward. I know you've got some research projects in the pipeline.
That's right.
Good. So what have been some of your biggest challenges going through COVID so far?
So I think initially, so our management team here in St. John made a quick decision to shift our department to a 2-team 12-hour shift schedule for the month of April. So with that change, there was an initial adjustment phase in altering workflow, so moving from a regular 7.5-hour day to a 12-hour day. And also balancing workload and teachings on the phone now. So there's a lot of change up front initially. But in the end, the 12-hour shifts ended up being enjoyed by some of our staff members. And it's actually something that we're looking at to potentially adopt in the future. So again, initially an adjustment, but probably a good change in the end.
Yeah, change for the better. It's interesting the things that initially you don't think you're going to like. 12-hour shifts being one of them, a lot of staff did seem to enjoy it, so that's great.
Yeah, there's definitely great opportunity, and there was some cross coverage, and then again some opportunities to change your practice just based on different hours that we wouldn't have had the chance to try it out, I guess, otherwise.
Good. And last question, so thinking back over the last couple of months, is there anything when you reflect on it that surprises you, or anything you learned about yourself or the people you work with?
Well, I guess first on a less serious note, scrubs definitely made a comeback within the pharmacy department. So I was a fan of that fashion movement for sure, and adopted a couple sets of scrubs myself. But in the end, kind of like I touched on with the last question, I think initially it was a change, but our pharmacy team as a whole, we're resilient, we're healthcare professionals, and we rise to the task at hand. So the group really supported each other, especially in those initial phases when our schedule was adjusting. So pharmacists, if they completed their tasks, were kind of back covering and helping to meet those immediate needs, which was great to see kind of everyone pull together. So really proud of the response that we had here, and again, hoping to learn from our experiences to improve things going forward.
That's great. Thank you, John, for taking the time to share your experiences with us today, and thank you to our viewers for tuning in for another episode. So we'll see you back next time on the COVID Chronicles. This has been Heather and John.
Thanks
Thank
for having
you.
me.